Strep throat or a sore throat. They both feel terrible, but they're not the same. Cases typically go up in winter months. Here's how you can tell one from the other.
So strep throat is a very common infection that we see in children.
And worth paying attention to. Dr. Elizabeth Mead is a pediatrician at Providence Swedish.
It's an infection that happens in the throat, sometimes the back of the throat, near the tonsils, that sort of area.
Here's the main difference. Strep is a bacterial infection, while a sore throat from a cold or a flu results from a viral infection. Dr. Mead says anything resembling a strep bacterial infection among kids should not be ignored.
It's important that we do treat it if it's there because that can prevent some secondary outcomes that we can see if it's not treated with the correct medications.
Secondary complications can lead to kidney inflammation and rheumatic fever that affects the blood vessels and joints.
It's not very common, but it is something we take into consideration. And so we just always want to make sure that we're treating strep throat if it's there.
So here's what to watch for. Strep throat symptoms typically include noticeable redness in the back of the throat and swollen tonsils. Young children might even have stomach pain. In comparison, regular sore throat symptoms usually come with other flu or cold symptoms.
I think the general tip is if you have symptoms that are really sort of localized to the throat, so it hurts, it's red, you've got swollen lymph nodes and maybe a fever, but like not much else, that's much more likely to be concerning for strep. If you have a ton of other runny nose, cough, cold symptoms, that's usually not strep throat.
Strep throat is mostly spread through saliva, so avoid sharing utensils and cups, things like that. If you suspect your child has strep throat, call a doctor for treatment, which is with antibiotics. For HealthLink, I'm Christine Pei reporting.